Norton Community Hospital did not treat COVID patients last winter. That has changed, though, during the Delta variant surge, and the small Southwest Virginia hospital's COVID intensive care unit has stayed mostly full the past month.
The data really makes it clear why. Southwest Virginia's COVID hospitalization rates are double the state rates, and it's been that way since September 1st. News Channel 11's Bianca Murray spoke with a nurse who oversees that ICU in Norton, who shared her personal perspective on what she sees every day on the front lines.
Well, Josh and Sarah, Lori Looney is a registered nurse who oversees the Norton Hospital's ICU, as this is the first time her hospital has had to take care of these incredibly sick patients. She has a warning to her community members who choose to remain unvaccinated.
One time have 2 to 3 patients depending, and we're truly just going from room to room, you know, it's almost like a war zone.
The small community hospital staff fighting to keep up with the burgeoning COVID patients.
Our COVID beds are staying full, our ICU COVID beds especially, and right now most of the patients we have are on ventilators that have COVID, and we're not having great outcomes. Not that we're not doing everything we can, and that's hard as a nurse because you want to help people and you go to school to be a nurse to help people, and we're doing everything we can, but just the prognosis is so poor.
The toll for the native of neighboring Dickinson County has become overbearing sometimes.
They're here 3 weeks or 4 weeks, you know, at their worst, at the worst of the illness. So it's very hard emotionally just because you spend so much time with these patients and you build relationships with their families. So that's very difficult when you lose a patient or when you see a patient not progressing like you would like for them to.
Time to process the intense emotional situations is limited.
You know, you only have so long because you have 2 or 3 or 6 or 7 other patients that need you.
Layered over the clinical stress is the sadness of seeing families unable to visit their loved ones in person.
It's so difficult, especially, you know, the multiple layers of PPE and trying to talk on the phone, and we have really nice windows in our ICU, so a lot of the patients will direct them through the parking lot, their family members to the window, and you know, they can kind of see that way, but even then, you know, the touch is missing.
She says the pressure keeps building, but the frontline workers will keep fighting for their community.
We have all the resources, we're doing all the treatments that anybody else at any other facility would do, and it's not working.
Coming up at 6, hear from a respiratory therapist who has worked at one of the nation's busiest black lung clinics. So she's no stranger to people having difficulty breathing, but she says the amount of trauma in the COVID ICU is unlike anything she's ever witnessed.